Hi, my name is Larynn Clopton, and today I will be going over my research project of the effects of utilizing a total task procedure with a visual model to teach a dressing skill to a child with autism spectrum disorder. Quick introduction. The participant is a 5-year-old female who attends an in-center ABA clinic Monday through Friday. The participant can complete other dressing skills on herself, but she is currently unable to put on her own shirt without assistance from her caregiver. And oftentimes she engages in negative vocalizations in the form of screaming when prompted to do so by herself. One of the many adaptive living skills includes dressing oneself, and the primary aspiration of a parent who has a child with autism is that their child would not have to depend on an adult their whole life. Teaching these dressing skills overall promotes uh, independence and personal autonomy. Will a total task procedure, with or without a visual model, be the most effective in teaching a child with ASD how to put their shirt on? I came up with this question because I wanted to assess the effectiveness of both of these chain procedures. And this learner is very receptive to visual stimuli, so I wanted to test to see which of these would be the most effective in teaching this skill. The setting will take place within the bathroom of the participant's ABA clinic, as this will best mock the privacy of her own home and promote client dignity as well. Previous research studies have shown that visual models and the use of chain procedures will lead to a steady and increasing result to reach mastery criteria when teaching new skills. So I feel like this combination would be very informative to assess. So just a little background with the method. An alternating treatment design was used to determine whether a total task procedure with or without a visual model would be more effective in teaching the participant how to independently put her shirt on. The dependent variable in the situation is the dressing skill of the independence of dressing, and the independent variables are the total task procedures with and without the visual model. With the visual model, this will be a learner similar in age, demonstrating the steps to put a shirt on for the participant to follow. Each step that the participant completes on her own will be counted as correct. In any instance she stops recording in the chain, these remaining steps will be counted incorrect. A total percentage will be completed and calculated at the end of each session. For this study, we conducted a total of 22 sessions, both morning and afternoon of her therapy sessions. The results show that the chain presented so during baseline, we promoted the chain without any prompting, just to assess where her current skill level was with this task chain. The participant showed a consistent average of being able to complete 20% of the steps of this chain independently. And this was also accompanied by several instances of those negative vocalizations in the form of screaming, as it was frustrating and she was unable to complete the chain. Once the total task chain without a visual model was presented, the learner did not show an increase in skills until the third session with the specific intervention. However, once the intervention with the total chain procedure was presented with the video model, the learner showed a steady increase in his dressing skill by 25% after the third session with the second intervention, which is the total task chaining procedure with the visual model. During the alternation of these two interventions, it was observed and noted that this participant's negative vocalizations slowly declined. In conclusion, the results in this graph show that the total task procedure paired with the visual modeling intervention was more effective in teaching this participant how to independently put on her shirt and complete all 6 steps. And going and to look at the graph here, you can see We collected 4 data points to just establish a stable baseline pattern. And as you can see, both procedures ultimately um, helped her independently learn to put on her shirt. However, the total task chain with the visual model was greater in percentage. And so this is what we chose to continue as with our best treatment. And as you can see, she was able to reach mastery criterion and was able to complete 100% of the chain by herself for the last 3 sessions. So going back into this, based on the results, sorry guys, based on the results shown by the graph, both total procedures displayed an increase. However, the total task chain paired with the video model was more successful as she began to average between 70 to 80% of the steps she could complete independently. This treatment, like I said, was selected as the best treatment and resulted in her reaching mastery criterion. So going back through this study, with the implications of my findings, the things that I learned from this project is it is useful to use video modeling and visual stimuli to help teach a new skill. And I feel like the limitations that I experienced within this study in limitations were at one point during this study, the learner was out sick for about 3 to 4 days. I think it was 3 days total with the stomach bug. So that kind of delayed, accurate data, as I feel like that may potentially had an effect on her and maybe some of the data points and some of those negative vocalizations a little more because she wasn't feeling well in those initial baseline data points. But once she came back, we reassessed with 2 more baseline data points, and then we began our alternating treatment design. The refinements that I feel like I would make in this situation is to make sure that the visual model resonates with that participant as best as possible. My learner was 5, so the person in the video model was similar in age for her, so it was easier to resonate. And there were moments of animation to make it more tentative for her in her interest. I feel like if we were to conduct this type of studies in the future, I feel like for future treatment design, visual models paired with chain procedures can be very useful in teaching things like social skills, maybe skills within organizational behavior management, or, daily life skills and things of this nature that's within my study. That is the rest of my presentation, and I want to thank you guys for tuning in. Bye.